Hi, everyone, and welcome. This is Dr. Tara Dominguez with TD Pharmacy Services. I have a very special guest with me today who's going to be talking about diabetic services, and I'm going to allow him to introduce himself to you.
Tara, thank you for having me. Hi, everybody. My name is Patrick Devereux. I'm a pharmacist and multi-store pharmacy operator in the Birmingham, Alabama area. The name of my pharmacy is FMS Pharmacy, is where I spend most of my time. And we've been providing diabetes services, diabetes education, and diabetes prevention services in our pharmacies since 2011.
That's awesome. So how did you get started in diabetic services? I know that there's a lot of interest in this field. A lot of pharmacists really want to diversify what they're doing and start offering more clinical-based services to their community.
Mine really started in pharmacy school. I had a great professor and mentor named Dr. Condit Style. Was an independent pharmacy owner at one point in his career, and really taught all of our diabetes, but also taught on implementing diabetes education services and clinical services inside the community pharmacy. And this was 20 years ago. So back then, clinical really hadn't made its way into the mainstream of community pharmacy like it is now. And so really my interest started there, and really just asking questions. Hey, is anybody really doing this and making it work as a business? So after I graduated, I went to work for Dr. Jonathan Marquis in Atlanta, who owns multiple pharmacies and had an accredited diabetes education program in his store. So I really learned about getting those things set up, setting up the curriculum, setting up things like accreditation from him and his clinical staff, and came back to Birmingham after that residency with him, and decided it would be a goal of mine in Alabama that's very hard hit with diabetes to launch diabetes services here in the community pharmacy. So I've been navigating the waters of Medicare and payment for services since then. It's been quite a ride, learning and working with national organizations and working to find out how do pharmacists not only provide these services, but have a business model and get paid for these services.
Exactly, because I think there's many people who want to do it, but it really gets into, how do you get paid for these services? Who's paying? What do the co-pays look like? And, in some communities, people don't have the money. It's really hard for them to, get the care that they need. So what kind of services are you currently offering in your pharmacy?
So we are doing, we have an accredited diabetes education program. We are accredited through one of the national organizations. I don't know if can I say it on the air? I don't know if it matters there. So sure. ADCES, we have accreditation through them. We've been accredited through them since 2011. And I want to pause for a second and remind everybody that accreditation for diabetes education in pharmacy is the exact same accreditation that a hospital-based program would go through, or a physician-based program. This is not a pharmacy-specific diabetes education program. And that's important from the perspective of not only engaging with patients, but also providers and referral sources in your community, that we are an accredited site, just like the hospital-based programs are. And we've seen in Birmingham many hospital-based programs close because they're it's not sustainable by itself, or at least they feel like that when they're looking at other expenses in the hospital. So we're currently providing diabetes education and billing Medicare Part B for those services. Medicare Part B is a very confusing animal, especially because we as pharmacists do not have provider status. So it's very challenging when engaging with payers that you're trying to bill for these clinical services, bill for these codes for clinical services, but you yourself as an individual are not counted as a provider. I could do an entire interview on provider status and the importance of that. But really, that's where a lot of the confusion, a lot of the payer speed bumps come in, is just this confusion about how do we pay pharmacists for these services. So we have our corporation credentialed to provide the service. The program itself is credentialed, not really the pharmacy. So as long as you have a credentialed program through ADCES or ADA, you can work with Medicare through their credentialing process to be set up to bill Medicare for diabetes education codes. In addition to that, we have a cash pay model that the important thing is with diabetes education, you have to charge patients the same amount that you would charge Medicare for those services. You can't really discount it. So we do that, and Medicare's allowables on diabetes education are not that high. So we actually have found a pretty good model for cash patients, and they're not necessarily cash patients, but they are patients who have insurances that may not credential pharmacies. Unfortunately, two of the biggest payers in Alabama do not recognize diabetes education provided by pharmacists, unfortunately. Actually, they don't, I don't think, and even one of them doesn't even cover diabetes education services in an outpatient setting at all, which is terrible because Mississippi and us are always fighting over who is first in diabetes, and we should not be. We should have access to these services. So to answer your question, it's mainly Medicare and cash pay. And the cash pay patients are usually, with the amount of content that we have in there for them, it's very rich content. They walk away with a lot of actionable things to help get their diabetes under control. We have encountered very little resistance in paying for services. And what's on the horizon with us is more engagement with employers, especially self-funded employers that really have a vested interest in controlling healthcare expenses for not only the corporation, but their employees. And so that's going to be I think our next line of business for diabetes education.
I love that. Yes, that's perfect, because if you can help them control costs, then, as small business owners, we know that that's a much needed thing. So tell me a little bit, what's the big overview, like a big, picture of how you go about even getting accredited? How do you even start doing that? How could someone do that in their state where they're at?
That's a great question. For pharmacists, I think the most important thing I would do first, before you spend any money, check with your state association to see if there are grants available, or maybe the state association or one of the schools of pharmacy in your state may have a grant. There was a lot of CDC was very generous this past couple of years in issuing grants to states for diabetes education expansion, Alabama being one of those. I'm also working with the Missouri pharmacists as well, but there are other states that have taken advantage of that, which is great, because the end goal for the CDC is to expand the number of accredited diabetes education sites, whether it's pharmacy or whoever, and a lot of pharmacy schools in Alabama, or Sanford in Alabama, and the State Association of Missouri, they've grabbed a hold of that through their State Department of Health funding, and have really given pharmacies some great turnkey options to become accredited. So not only, so I would check before you research organizations to go through, check with your state, check with your Department of Health, or state association for pharmacy, or schools of pharmacy, just to see. I would start with the Department of Health just to see if there's grant funding available for the pharmacy to become accredited for diabetes education.
That's perfect.
That's step one.
Yeah, that's perfect. Yeah.
And then step two is choosing an accreditation organization. So there's a couple out there that are, if you accredit your program, your curriculum through them, then that is enough for you to say to Medicare, okay, look, I'm now an accredited diabetes education program through one of these organizations. I'm going to fill out this form and credential with you as a provider, and bill for diabetes education services. And most of those both of those organizations that offer accreditation, not only offer accreditation, but really do have some turnkey solutions for you to implement a curriculum, to implement policies and procedures. Those are the things for diabetes education accreditation the accreditation organization is going to look at. They're going to look at your curriculum. They're going to look at your policies and procedures regarding how you engage with patients, how you engage with their providers and give them updates and how they're doing in the program. What does your curriculum look like? And a helpful resource for anybody listening that wants to understand what the accreditation organizations look at. Both organizations base their accreditation on the National Diabetes Education Standards. Those are very easy to find online. They're national standards. They're not from only one organization. So national standards for diabetes education, I believe there's 20 or 21 of them. And the accreditation organizations essentially are looking at those, looking at how the pharmacy has those things put in place. And that seems, I know when I say that may scare some people off. Oh no, another policies and procedures, accreditation, all this. But really it's just formalizing there's a diabetes education curriculum and formalizing your process for patient care. And again, both organizations have great resources available to you that are just turnkey solutions that have curriculums available that you can adopt, policies and procedures, resources for patients, resources to put in their charts, things like that. I will say the accreditation process for diabetes education, we've all of our accreditation has been virtual. So when your organization is ready to submit your standards and to submit your policy and procedure manual, and you are going to submit probably one patient chart. So you're actually going to put somebody through the program before you apply for accreditation. Once you're developing all that, you submit it and you have a phone interview or two with the accreditation organization, maybe on site. With COVID, maybe everyone's resuming travel, but the last several years we've done ours. We do have to reaccredit every few years, and we've done all of ours virtually. And one point about that is I think a lot of people, and myself included, we kind of fear accreditation, that word. It's like, oh no, it's a bunch of regulators coming in to tell us how much we're doing wrong. I want to encourage everybody, especially if you're interested in diabetes education, if you're going to go through accreditation, use it as a learning opportunity. The accreditation organizations, both of them, they want you to succeed. They want to expand. They want you to be able to expand diabetes education to their patients. They're not there to, this isn't a preferred network PBM who's trying to squeeze you out. Okay. That's not what this is. They want you to succeed, but they want you to succeed with excellence. They want to make sure that anybody that they're putting their stamp of approval on is, hey, this pharmacy is an accredited site, is operating with excellence and taking care of their patients according with their standards. So that's a place to start, is looking at those organizations. ADA and ADCES, they're both great organizations, and seeing which one might be a better fit for you from an accreditation standpoint.
I love that you bring up the point of, these organizations are not out to get you. This isn't the state board. This isn't PBM. Right. It's like, they really want to work with you. I mean, they're spending millions, hundreds of millions of dollars in grant money to get these services going in these communities, because we know the long-term impact that they can have. And I think that that's great that you're doing this. And I really love your model. So kind of getting back to your pilot patient and the patient experience overall, what does that look like for a patient to work with you in your pharmacy? How do they find you, and how do they get started, and what's the follow-up process?
Yeah, that's a great question. Initially, our recruitment was just in-store recruitment. We had some materials printed up that we developed with a pharmacy marketing organization, that we were doing bag stuffers and things like that. And we were targeting patients, that had Medicare, or maybe if they didn't have Medicare, they might be interested in a cash paying model. So we did a lot of in-store recruitment at first, but what that's turned into over the last several years has been, as hospital-based programs have kind of closed and or they've at least stopped putting as much energy into diabetes education as they have in the past, we've become a referral source for a lot of outpatient physician practices in our area. Now, the hospital in our area, and we're very close to one here, they do have inpatient diabetes education. They do have inpatient training at the bedside of hey, now you're going to be on insulin. Here's what to do. But in terms of continuation of care, outpatient, so that's become quite a marketing source or referral source for us, has been that. So to answer that question, our patients are coming from referrals from physicians. All of the physicians in our area have a very simple referral form that we developed, and they fill that out, fax it in, and we engage with the patient. But going to your question about what does the patient experience look like for the first patient, I will tell you that the first patient we put through, we've really refined our process since then, but our first one was a little bit more didactic, and we tried to make it as interactive as possible, but our accreditation organization actually pointed out, hey, all you're doing is just teaching. Where's the interaction? Where's the individualization? And once we started looking at our processes, we made some changes, and I think the patient experience now is even better. And we did get feedback from the patient as well. The accreditation standard for feedback is just make sure you're tailoring your learning to the patient's individual learning needs. But we used it as an opportunity as well to perfect the program. I'm really big on customer feedback when they can be honest. Sometimes like, oh yeah, it was great, it's great, but we really do thrive on that and try to perfect the process to do this with excellence.
No, I think that's a great point too. And that's why I kind of brought it up with the pilot patient, because it's important for pharmacies to know that, hey, this isn't going to be perfect. When you first start, there's going to be a lot of things along the way that you're going to need to change and alter. And these accrediting bodies too are going to help you out. But there is a lot of, other things that, might be involved as well, that pharmacies might feel like they need a little extra hand-holding along the way. So Patrick, is there anything that you would like to share on how people can work with you to get a little bit extra hand-holding through this process, and they don't have to basically recreate the will if it's already been created?
Well, I will say that I'm happy to help any pharmacy that is interested in providing diabetes services. We're going to put a link to my calendar into the notes, and just sign up for a time, or I'll also put my email address and numbers in there so that you guys can contact me. But really, my expertise in this area comes from a lot of trial and error. So Medicare, especially, my expertise outside of the diabetes education accreditation is working with Medicare. Because we had such a hard time with Medicare, and I had to learn a lot over the last several years. And there's a lot of confusing information about how pharmacies get set up with Medicare to bill for services. I'm here to clear through all of that for you. I will do everything. I work with a couple of states right now, and their pharmacy groups to help their pharmacies become not only accredited, and they have a lot of the accreditation stuff taken care of. But it's my job is at that point, okay, now you're accredited, great. How do we get you paid for services? What does it look like? And that can be, there's a lot of confusion out there, especially when you have different Medicare contractors around the country, and all of them seem to have different interpretations of how pharmacists are supposed to be set up. I'll tell you a really quick story. But the reason why I've become an expert in this is because about 10 years ago, we were first getting set up. I actually had to engage at a very high level with somebody at CMS because Medicare in Alabama was saying, we cannot pay you for this. We don't know what you're talking about. We have absolutely no idea what you're trying to do. You do not have an NPI number that allows this. And so I called a national, I want to be careful with names, but because national organization, a very big national organization for pharmacy, and got a high ranking person in there to put me in touch with a high ranking person at CMS, and they did. And the CMS wound up calling the Medicare contractor and getting all of this cleared up because it's just, there was, according to them, 10 years ago, I apparently was one of the first pharmacies to try to do this. And so there was no procedure manual or anything like that. There's a lot of confusion. When you don't have provider status, it's very, very unusual for a non-provider status practitioner, and normally who's being paid by pharmacy benefit managers instead of the medical side, to do this. So all that to say that my job is to help more pharmacies develop clinical services, even beyond diabetes education, that allows them to offset these ridiculous trends we're seeing in the marketplace, and decreasing margins and increasing costs and things like that. All pharmacies, and this is all of healthcare, but especially pharmacy right now, has to embrace change, has to look for innovative ways for clinical services to come in. And that really does involve thinking outside of the traditional PBM model, even the traditional dispensing model. My job is to help coach pharmacists that want to do that, that are willing to do the work to be able to do that, especially in the field of diabetes.
Absolutely. And you're the pioneer. I mean, you pioneered this whole thing, and oh my gosh, I love that story. If there's a will, there's a way, right?
Mm-hmm. That's right.
So yes, I think, if a pharmacist would like to, get a hold of you, well, we're going to drop a link below so you can connect with Patrick. And do you have anything else that you would like to share, Patrick?
Just to reiterate what I said earlier, those of you that are in pharmacy, whether you're an independent pharmacy or any other practice setting, this is the beginning. Well, not the beginning. We've been involved in clinical services for a long time, but the shifting of thinking, has always been, well, some pharmacies are clinical, but not all pharmacies are clinical, or so they have the staff to do these services, whatever. Nobody is seeing prescription margins increasing from pharmacy benefit managers right now. That's not happening. DIR fees, regardless of what, I know we've seen some big news on that the last several weeks. We can complain about that stuff all day, or we can choose to take action. We can choose to look at our business, look at our model, and decide, do we want services coming in that don't touch a PBM? Anything that doesn't touch a PBM, I'm interested in, whether it's cash business, whether it's OTC sales, whether it's clinical services like we're talking about today, regardless of what the allowable is. Some people may look at diabetes education and say, oh, that's not enough money. Well, think about your prescriptions and think about how much you're losing in loss margin and DIR fees. If you can have a sustainable source of revenue coming in that doesn't touch that, and use your clinical skills that you learned in pharmacy school, and have a rewarding encounter with the patient, why not do it? So I want to leave it with just encouraging all pharmacies in all settings to really change this thinking. I do think dispensing is always going to be central to our model, but don't stop there. There is opportunity to thrive in this environment if you're willing to do the work.
Exactly. Diabetes isn't going anywhere. I mean, that's just the truth of it. America is getting larger and larger as a country. There's more refined sugar in every single thing that we eat. So it's important as pharmacists on the front line to offer these clinical services to your community so they can walk in, have that discussion with you, and walk out with knowledge. So I thank you so much for your time today. And I look forward to all the things that you're going to be doing in the future. And have a wonderful day, everyone.
Thanks for having me, Tara.
Thank you.